Oh, good evening. This is Dr. McDaniel. It's today's Tuesday, April 30th, and I'm answering two viewer questions this evening. The first question was a viewer asked about what to do for recurrent vaginal infections, and I directed her to the previous presentations I had placed here on Facebook and also on YouTube with respect to recurrent vaginal imbalances or infections. Be they yeast, fungal, bacterial, or a mixed combination. And in brief, I'll just recap a couple of the highlights for that information. The first one is that we don't get excited about imbalances or infections unless they're causing symptoms. So be it yeast, fungal, bacterial, doesn't matter. If you're having itching, irritation, discomfort, odor, any kind of physical ailments or problems with it, then yes, that's considered an infection and can be treated or addressed. Most commonly, if there's a bad odor is always due to bacteria, regardless of where the odor is coming from or what the source is. It's going to be at least some form of a bacterial overgrowth or imbalance, with or without yeast, fungal elements, or even potentially a sexual infection involved. The treatment for bacterial infections, if you don't want to see your physician and get a prescription, would be to either, a lot of people will get help from going to the drugstore and getting a vaginal pH gel balancer. The most popular one is Refresh with pH, so it's REPHRESH, so Refresh gel. They have those in several different levels, so either a sporadic one is a one-time use or a recurrent one to use to maintain a low vaginal pH. Sorry, I have allergies this week, it's pretty bad. So the Refresh gel is a popular one, and the theory behind it is to place a gel, not a douche, it's just a gel, so it sits in the vaginal vault to lower the vaginal pH to where it's supposed to be, acidic, and that becomes a hostile environment for bacteria. Another option that works really well are garlic inserts. So you peel a garlic, you get the clove. With the clove, you place a thread several times so you get kind of a thick loop for it. You place that in the vagina before you go to bed. You take it out in the morning. I've had lots of patients over the years who have followed those instructions and they've gotten really good results from the garlic clove. And the catch with the garlic clove is it does have to be a repetitive process. So if you first notice an imbalance, a discharge, a irritation, a bad odor, you place the garlic clove that night, and you place it every night for at least a 7 to 10 night straight time frame. Over that time frame, you should notice an improvement in your symptoms. And then after the 7 to 10 nights are over, you want to taper it down. So you place it every other night for a week, and then 3 nights a week for a week, and then 2 nights a week for a week, and then once a night per week for 3 to 4 weeks to give some kind of continuity for it. Most women will have a vast improvement just from doing the garlic clove inserts. If you add something to the garlic clove insert, and that something is most commonly going to be a probiotic, doesn't matter the brand of probiotic, but whatever the instructions say on the probiotic, you want to take twice as often as the instructions indicate. So if it says to take the probiotic twice a day, you're going to take it 1 tablet 3 to 4 times a day. If it says once a day, then it's going to be 1 tablet twice a day. I found over the years that the instructions on the probiotics work really well if you're taking them for intestinal issues, but most women will need to double up if they're taking them for vaginal issues. After that, a lot of women have done the tea tree oil on the tampon. That doesn't work as well, in my opinion, as the garlic. And women who do get relief from the tea tree oil, they usually has to be around the clock. So the tea tree oil on the tampon, a fresh one before you go to bed, and then a fresh one during the day, along with taking either probiotics, or what works really well is lysine. In conjunction with lysine, L-lysine, that's an amino acid. You take that twice a day, 500 in the morning, 500 in the evening, not 1,000 milligrams, but 500 in the morning, 500 in the evening. You take that every day for at least a 7 to 10 day block of time for any sporadic issues, along with the tea tree oil or along with the garlic inserts. And then what I always recommend, in order to prevent recurrent imbalances, you have to be religious with the supplements. So to prevent recurrent imbalances, the most, I'm going to say, successful combo is the L-lysine twice a day, along with the doubled up probiotics every single day, like your life depends on it, for at least a 6-month block of time. That works really, really well. I've gotten really good results from women over the years. So I hope if you go back through the YouTube channel is easier to just sift back to the I think it was a 3 or 4 day series on vaginal imbalances infections, but that's kind of like a cheat sheet, quick to do for now. With respect to the viewer who had questions about breast pain and lumps, she did not go into details about the breast pain or lumps, but obvious to me, but I always have to state the obvious. If you have any new onset of breast pain or new onset of masses or lumps, the first thing you'll want to do is see your gynecologist for an exam evaluation. But in general, breast pain and lumps, if they flare up before the cycle and go away when the cycle goes away, so anywhere from 2 weeks before the cycle up to through the cycle to the end of the cycle, breast pain and lumpiness is considered normal if it goes away once the cycle goes away. That's what we call fibrocystic breast disease or fibrocystic changes. So the breast is made up of fat, fibrous tissues, glandular tissues, and ducts to carry milk if you're nursing. The breast are what we call hormonal organs because they respond to your body's hormonal changes or estrogen fluctuations. So if someone is not on birth control pills, there's just a natural cycle, then when they ovulate, the estrogen level spikes, and with the spike in the estrogen level, that will induce subsequent changes in the breast tissue. And for some women, it can be exquisite pain and tenderness because of the response to the estrogen levels, the stimulation. Exquisite pain and tenderness where they can't lie on the bed, they can't barely have the bra too tight, they can't touch their breasts, it's very, very painful. For some women, the breast size, the cup size will increase a whole cup size, so they have different set of bras that they wear before the cycle versus after the cycle. Sorry, and lumpiness or fibrous areas can increase. So I've had patients come in with walnut or even plum-sized lumps in the breast before their cycle. I have them come back after the cycle and they're either completely gone or they're like the size of maybe a peanut or a green pea. So it can be a drastic change. Those lumps are usually either going to be tissue-filled lumps, so they're fibrous, or they're going to be liquid-filled lumps, so they're cystic. Regardless, they're just hormonal fluctuations in response to ovulation and the increased levels of estrogen that occur after you ovulate. They will go away with the menstrual cycle. Now, if you have a lump that flares up before the cycle, it doesn't go away once the cycle's over, or more importantly, a lump that you didn't have before the cycle, but it flares up after the cycle, then that's not considered normal. Always should be evaluated to see what the source is or what the story is with that. Sorry. A treatment to reduce those symptoms or to decrease the prevalence or the severity of those symptoms, the simple treatment is just low-dose birth control pills, because you don't ovulate on the pills. You don't ovulate, you're not going to have ovulation hormonal flare-ups, and you're not going to have ovulation hormonal responses. So the quick treatment is just to go on the low-dose birth control pills. That will drastically reduce those breast symptoms. A homeopathic treatment, a lot of women will take evening primrose oil. That's at all the health food stores. It will help if you have mild breast tissue changes. I haven't seen it help for severe ones. And then the Lady Pinkum or the Lydia Pinkum, is another one. It has black cohosh and about 7 other herbs in it. That will also help to varying degrees for a lot of women who have mild fibrocystic breast changes. But as I said, if those changes flare up before the cycle, sorry, and go away with the cycle, they're not health worries or concerns. They're just effects of ovulation. So I hope that was helpful. Answering 2 of your questions, one on recurrent repetitive vaginal imbalances or infections, and the other one on breast changes, pain, and lumps that occur with the cycle. This is Dr. McDaniel. It's Tuesday, April 13th from GYN Corner. I appreciate you're giving me feedback on this Facebook live streams and on the YouTube channel is also GYN Corner. Any questions you have, please feel free to message through the messenger bot through Facebook or to post a message on the YouTube. I'm happy to answer them. And if you have suggestions or concerns or curiosities or questions for additional presentations, I'll be happy to do that too. If this is anything health related for women, GYN is the predominance, but I'm an obstetrician gynecologist by training. I practice OB GYN for almost 30 years now, so any questions on obstetrics and around pre and post pregnancy fertility issues, the world's your oyster. I'm happy to answer. Thank you for watching, and everyone have a good night.